style questions focused on endotoxin-induced complement activation and its downstream effects like histamine release, hypotension, and edema, with explanations for the correct and incorrect options. Question 1. A 75-year-old woman is hospitalized with septic shock secondary to a Klebsiella pneumonia infection. Which of the following immune responses is most directly responsible for her hypotension and edema? A. Activation of C3 convertase. B. Release of reactive oxygen species from neutrophils. C. Complement C3a and C5a induced histamine release. D. Interleukin-2 stimulation of T cells. E. IgE-mediated mast cell degranulation. Correct answer, C. Complement C3a and C5a induced histamine release. Explanation: endotoxin lipid A from gram-negative bacteria activates the alternative complement pathway, generating C3a and C5a, which are anaphylatoxins. These promote histamine release from mast cells, vasodilation, and increased vascular permeability, causing hypotension and edema. A. C3 convertase is upstream. It does not directly cause histamine release. B. ROS contribute to cell injury but not directly to hypotension or edema. D. IL-2 is involved in T-cell proliferation, unrelated here. E. IgE mast cell pathways are involved in allergy, not endotoxin-mediated shock. Question 2. A 62-year-old man is in the ICU with gram-negative sepsis. Despite aggressive IV fluids and antibiotics, his blood pressure remains low. Which complement-mediated event contributes most to this patient's hemodynamic instability? A. Formation of the membrane attack complex, MAC. B. Binding of C1q to bacterial antigens. C. C3a-mediated smooth muscle contraction. D. C3a C5a-mediated mast cell degranulation. E. C3b-mediated opsonization. Correct answer, D. C3a C5a-mediated mast cell degranulation. Explanation: C3a and C5a, generated by complement activation from endotoxin exposure, stimulate mast cells to release histamine, causing vasodilation and increased capillary permeability, which leads to hypotension and edema typical of septic shock. A. MAC lyses bacteria but does not directly affect blood pressure. B. C1q initiates classical pathway, not the major pathway activated by endotoxin. C. C3a does not contract smooth muscle, it causes vasodilation. E. Opsonization by C3b helps with phagocytosis, not hemodynamic effects. Would you like